Hi everyone, my name is Allison Warren. I'm the Multimedia Public Relations Specialist here at Sarasota Memorial Hospital. In light of the ongoing COVID-19 pandemic, we've received a number of questions about how people can properly take care of themselves if they're sick with COVID-19 and riding out the virus at home. To help get us those answers today, I'm joined by Dr. Jack Rodman, the Chief Medical Officer of First Physicians Group, and Dr. Joseph Seaman, a Critical Care Pulmonologist. Thank you both for being with us.
Thank you.
Thank you, Allison.
So Dr. Rodman, we've previously discussed at length that many people who have COVID-19 have few symptoms of any and may never even know they've had the virus, while others are hospitalized with much more serious symptoms. What can you tell us about the disease and the number of people who are asymptomatic or have mild or moderate disease and will recover at home?
Well, I think that's the good news. Our epidemiologists tell us that 80% of those folks that get COVID will be asymptomatic or have very mild or moderate disease and will recover at home without the need for hospitalization.
That is good news. And Dr. Rodman, symptoms vary widely person to person. So what can people expect day to day in the course of their illness if they get COVID-19?
Yeah, so the incubation period after this exposure to this virus can be anywhere from 2 days to 14 days. The virus can't live alone without a host, so it uses humans and other animals, our cells, to serve the role of reproducing and duplicating itself. That process then causes damage to our cells, our epithelium, what lines our upper respiratory tract, our lungs, our GI tract. So, ultimately, the virus can cause a multitude of symptoms based on the extent of that damage to our cells. So it can be as simple and minimal as a mild fever. The most common side effects are obviously fever, dry cough, tiredness or fatigue, and shortness of breath.
All right, now Dr. Seaman, can you expand on the type of symptoms and when it's safe for a patient to stay home versus seek hospital care?
Yeah, that's the real important question is when does the illness get to a point where it's severe enough that you need to seek help? As a pulmonary doc who takes care of a lot of lung patients, what I try to tell my patients is to focus on their symptoms so that they can give an assessment of where they're at, what kind of symptoms they're having, because that's going to help direct that person to seek the care they need. So for me, when patients tell me they're a little short of breath, they're a little cough, they have some aching, they have a sore throat, those are all relatively mild symptoms that are known to be associated not only with this virus, but all typical viruses. And anything that's considered mild or moderate, we generally tolerate, and we tell folks that they can stay at home. What I've been trying to educate my patients is to do if they feel bad, to do a critical assessment of not just their symptoms, but what I call their vital signs. So if they have the capacity, take their blood pressure, see what their blood pressure is doing. If they have the ability to check their pulse, what is their pulse? Is their pulse really high? Is it really low? Many of my patients that have lung disease have what's called a pulse oximeter or an oxygen tester that tells them how high their oxygen level is in their blood. For most normal people without lung problems, their oxygen level should be between 95 and 100%. Patients with chronic lung disease or other medical conditions may have a lower oxygen level at baseline, but anyone who has a low oxygen level, let's say below 88%, that person needs to contact their medical provider and have a more formal assessment. So those are a few of the objective things that I look for when I'm talking to my patients over the phone to try to assess how they're doing and where I need to triage that person to. So what symptoms are they experiencing, the severity of the symptoms, and then if they have some objective way of giving numbers, their blood pressure, their pulse, their oxygen level, because that gives me more data and more information to help give them the feedback that they need. Do they need to stay at home and take Tylenol and rest and fluids? Or do they need to go to the emergency room and have a more formal evaluation such as labs and x-rays? Do they need to be admitted?
And I think it's important to point out, Dr. Seaman, that if you are experiencing severe symptoms, definitely make sure you are seeking the hospital care. Don't wait until they get even worse, right?
Absolutely, absolutely. And that's where I think the symptom severity as well as the objective measures help give you the confidence of how to proceed. So if you're having chest pain, you should not stay at home and try to tough it out. If your blood pressure is severely low or severely high, or you have a critically low oxygen level, you shouldn't stay at home. That's what the emergency room's for. That's what the hospital's for. We're here to support those patients and take care of those issues.
Dr. Rodman, for those patients who are able to tough it out at home, who don't have those extremely severe symptoms, are there any at-home remedies to help them manage their symptoms?
Yeah, absolutely. I mean, I think ultimately the goal is to help alleviate symptoms and then to prevent worsening illness while the body heals. Some of the simple things are rest. It's important to just rest as your body is convalescing. I would say there's one caveat to that, and that's the fact that we really don't want to have secondary pneumonia. So this virus may make your body want to lay in bed, but I think it's important that you get your rest, but it's also important that you sit up, stand up, exercise your lungs and expand them in order to prevent the potential for a secondary bacterial infection or pneumonia. I think the second thing is drinking fluids and eating healthy. You know, you lose a lot more water in your system when you are sick, and dehydration can certainly make symptoms worse and can lead to other problems. So we want to really work on that and healthy eating. And then I think finally, as you do work towards alleviating symptoms, there are some simple over-the-counter remedies. Certainly acetaminophen or Tylenol is really the most useful medicine for decreasing headaches, muscle aches, and fever that are associated with this and most other viruses. Ibuprofen is a second option. Initially, we were worried about some increased risk with ibuprofen and COVID. I think the key is if you do have any heart or kidney disease, to really check with your provider before using a medicine like ibuprofen as well. And then there are the standard over-the-counter cough and cold medicines, things that we've used throughout the years for the typical cold, whether it be cough medicines or decongestants, some of the saline nasal sprays, but there are home remedies as much as just using a warm shower or humidifier to help with some of these symptoms at home.
Dr. Seaman, are there any at-home treatments that you recommend to help those who are struggling with the disease stay out of the hospital, like breathing exercises or any other exercises they can do so they don't get those secondary pneumonias that Dr. Rodman talked about?
Yeah, and unfortunately, there's no clear, readily available treatment for COVID-19. What I'm telling my patients is if they have COVID-19 and they have mild symptoms and their vital signs are normal, staying at home is probably the best place for you. And just like Dr. Rodman pointed out, Tylenol, rest, fluids are really important to help give your body the energy it's needing to fight off this illness. I cannot understate the importance of moving. You know, we often when we're sick, we just want to kind of lay in bed and rest. But as Dr. Rodman pointed out, we have to move these folks because there's a lot of concerns about getting sicker if you're laying around and not taking deep breaths, you're not coughing, you're not moving, because then you're at risk for a whole host of secondary problems, like Dr. Rodman pointed out, pneumonia, blood clots, and so forth. So what I try to tell folks is every hour on the hour, you need to get up and walk through your house for no good reason other than just to move. You need to, when you're walking, take deep breaths and purposely cough so you're clearing the phlegm from your lungs to open your lungs up and help clear the mucus. There's unfortunately no readily available remedies. There's no concoctions that can be delivered that's going to make this go away faster other than alleviate the symptoms. So if you're having excessive coughing, you can try an over-the-counter cough remedy to see if that helps improve that. If you're having a sore throat, you can try a lozenge to help alleviate any of the symptoms you're having. But the importance of the patient is also to make sure that their nutritional status is maintained. And a lot of times you may not feel like eating or drinking during this illness, but You have to maintain some level of caloric intake to give your body the ingredients it needs to fight off this virus. And then lastly, and I want to make sure that everybody continues to tend to their other medical problems. If they have diabetes or heart failure or COPD, you oftentimes will have a medication regimen that you need to take for that disease process, and you need to continue those medicines. You may need to reach out to your medical doc or your medical provider to see if you need to adjust any of your doses of insulin or any of your pills, but you make sure that you continue to take care of your other medical problems.
Dr. Rodman, if someone is experiencing symptoms of COVID-19 or has tested positive for COVID-19, who should they be turning to for medical advice? Do they come to the hospital immediately? How should they handle that?
Yeah, I think as long as the symptoms are mild, and as Dr. Seaman has said, you know, they're actually sort of logging and tracking their symptoms and can kind of manage, then I think you know, the waiting out a typical normal course is appropriate. I think that with, you know, heightened symptoms, if you're have worsening symptoms, you know, 7, 8, 9 days into it, I think that that's really important that you do reach out to your primary care provider and touch base with them. I think it's important to call them. Many times your primary care provider can give a lot of important insight and management tricks, care, testing, options that may be available if we feel like the symptoms are worsening. And certainly those red flag symptoms, the serious symptoms, absolutely emergent. They must call EMS and get to the emergency room.
And Dr. Rodman, if someone is able to ride out the illness at home, how can they prevent getting loved ones around them sick?
Yeah, I think that's a huge aspect in management at home, and that's the avoidance of affecting others. And I think you know, we call it home quarantine, self-isolation. I think first and foremost, you have to have a safe place to isolate. Sometimes that's not so easy. Ideally, we like to have a separate bedroom and a separate bathroom. If that doesn't exist, it's really important that both the patient and the caregiver are both masked and gloved. We want to wear masks, wash hands regularly. You know, avoid sharing common items, that's vital in the home management of this COVID-19.
Great. Dr. Seaman, how does the at-home treatment and the patients who are able to manage this disease from home differ from the patients who are sick enough to be in the hospital?
So as I mentioned before, we continue all of the medicines that the patient may have related to their other medical problems. The unique things that if patients are sick enough to be in the hospital, other remedies that we use are good supportive care. If they have low oxygen levels, we give them oxygen. If they have some abnormality within their glucose or their other medical problems start to spiral out of control, we deliver treatments that may be needed to help control those. And then once we start focusing on the COVID-19 treatment, there are a few treatments that in the recent literature that's coming out that have shown some promise. Those include an oral steroid called Decadron or dexamethasone. There's some literature that shows that may help shorten the disease course and may improve outcomes. So we've been using that. In some patients, there's a medicine called remdesivir, which you all have probably seen in the literature that's been used to treat this. What's coming out now is that remdesivir seems to play a role in a certain subset of COVID-19 patients, specifically those who are on oxygen but not on the ventilator. It seems that once patients make it to the ventilator, remdesivir doesn't seem to work. So we're not really giving it at that time. And there doesn't seem to be all that helpful to people that are not on oxygen. So we're not giving it to people that are not on oxygen. So there's some nuances about the remdesivir. And finally, what's available to us is something called convalescent plasma. and that is a medication. It's not really a medication. It's a blood product that's derived from patients who have had COVID-19 and recovered, and it's basically the antibodies from those individuals that they're receiving. Here at SMH, we're also part of a clinical trial where antibodies that have been designed by a company to attack COVID-19 are being delivered. That's a research study, and we're proud to be one of the few places in Florida to offer that study, and one of 45 nationwide to do that. But those antibodies are directed directly towards the COVID-19 virus, and it helps treat that. So those are the things that we're doing here in the hospital.
Thank you, Dr. Seaman. Now, Dr. Rodman, you talked about monitoring some of those symptoms from home for those patients who are writing it out at home. At what point in the fever should they be contacting their primary care that they're concerned the fever has gone on too long? I mean, with COVID-19, the fever can be prolonged, correct?
Absolutely. You know, the average onset of symptoms after exposure is usually around 4 to 6 days. And really it's after those symptoms start, it's really around 7 or 8 days into that symptom complex that if we're not getting better, that's certainly a time for concern. If there's continued ongoing fever, you know, past that, we would, again, want to make sure that we do contact our primary care provider and at least discuss those issues with them with that information that Dr. Seaman had talked about. Yeah, I think the key is control your fever. That is a symptom, and high fever can be, you know, can cause other things, severe things such as seizures and whatnot. So we want to control that fever with Tylenol, secondarily ibuprofen.
Great. And Dr. Seaman, or excuse me, Dr. Rodman, you also spoke about proper nutrition and proper fluid intake. Can you be more specific as to what people should be eating, or any supplements they should be taking, or how much they should be drinking?
Yeah, I mean, you know, bottom line is, you know, you want high caloric content, you want fruits and vegetables, you want nutritious foods that have really the vitamins and electrolytes that will help support your body. As far as fluids go, certainly water is great. Excessive amounts of water without some electrolyte balance can sometimes be an issue. And so things like, you know, Gatorade, whatnot, you can dilute some of those types of sports drinks and they work just fine as well. The key typically, you know, and it depends on many things, your size, level of dehydration, but, you know, typically it's safe to 1.5 to 2 liters a day of fluid through an illness like this with fever would be adequate. And you know, again, we want to look at urine output, making sure you're able to go to the bathroom and do all of that as signs that you're getting enough fluids.
Great. And Dr. Seaman, both you and Dr. Rodman discussed that it's important to quarantine at home if you do have COVID-19. Can you talk about how you recommend to your patients they handle maybe distant family members or friends or neighbors who want to help them if they're home quarantining with COVID-19? How can they ask for help properly from those people without putting them at risk?
Yeah, that's the hard part here, because one of the unfortunate things with all of this social and physical distancing and quarantining means that we're no longer social beings, and that has led to lots of issues with isolation and made it so much more difficult, because when anyone's sick, we as humans want to go and help alleviate the burden of disease on our loved ones. And unfortunately, we shouldn't do that, and we can't do that, because then that could spread the illness. However, that doesn't mean you can't help. You can still continue to support that person. You can continue to help that person. It's just you have to change the way you do that. So calling and checking on them 2-3 times a day to make sure that they're doing okay, they're still toughing it out, and their symptoms haven't gotten worse. That's one thing. So regular communication and regularly checking on them. If they don't have the things that I mentioned before to help monitor their disease and their symptoms, maybe you can help get them a blood pressure cuff. Maybe you can help get them a little pulse ox checker. Those are some things that you could do, is provide them the tools that they need to self-monitor at home. As Dr. Rodman pointed out, staying hydrated and keeping your protein intake and your nutritional intake up is important. So maybe you can go to a Publix for them and get some groceries. You can take those groceries and drop them off at the front door for them. Maybe they are so sick that they can't make their own meals. Maybe you can prepare a few meals and take them and drop them off at their front door. So there are things that you can do to continue to support that person. You can continue to engage them, and you can continue to give them the things that they need to take care of themselves at home.
Great, thank you, Dr. Seaman. And Dr. Rodman, as Floridians, we are used to being prepared. We're used to having hurricane preparedness kits, for example. So some people are starting to talk about COVID preparedness. What would you tell someone they should have in their COVID preparedness kit?
Yeah, well, I think a COVID kit is a great idea. I mean, first and foremost, you want your emergency contacts. You want your family, friends, caregivers, to remain connected. The phone number of your primary care provider, and even the emergency room and EMS. I think it's important to have face masks and gloves present for your caregiver and for you if you can't meet those social distancing ability as you're self-quarantining. So the thermometer that we talked about as far as monitoring your fever. If you do have chronic illnesses and have a pulse oximeter, that's an important piece of that COVID care kit. Certainly the household cleaning supplies, disinfectants, sanitizing types of things that you need to manage around the house while you're self-quarantining, extra sheets and towels, and then a notebook. You need to write some of this down. How are you feeling? What are the vitals? What are the questions that you want to ask, whether it be a friend, family, neighbor, or your provider?
Great. You've both given us so much great information. Is there anything else you want to add or anything you want to say to those people who are currently toughing it out at home?
Well, this is a tough illness, and it's a tough situation. More will be coming down the pike, even with the outpatient management. And I think that more directives will come over time. And we hope that this is just the start of how we better learn to manage this over time, especially at home.
Dr. Seaman, anything else you want to add?
No, I just, it's amazing to be part of a team here at SMH that's taking care of these patients. And, it's the full spectrum. It's the outpatient providers, it's the inpatient providers, it's the nurses, the therapists, the physical therapists, the nutritionists, the hospitality staff have just been amazing through all of this. And it's so rewarding to be part of that care team, to be able to do that. And it's such a good feeling to know that we're doing what we're trained to do. But that same feeling can also be achieved by people at home, helping out their neighbors, helping out their friends, helping out their loved ones to get through this. And, the team doesn't just start with taking care of their neighbors or their friends or their loved ones that's sick with this. Wearing a mask and being keen on social distancing and hygiene is also taking care of the community as a whole. So the more we kind of help to take care of our community, the less of an issue this is going to be, and how we're all in this together. And that sense of accomplishment is going to happen when we drive down all of these numbers and we see less of an issue in our community.
It's a wonderful full point. Thank you so much, Dr. Seaman. And thank you again, Dr. Rodman. It's such helpful information for the community and for those who are fighting COVID-19 at home or may in the future. So thank you again. And of course, we encourage everyone to get the very latest information from smh.com/COVID-19. There are wonderful resources there as well. And we encourage everyone to stay safe, stay healthy, wear their masks, wash their hands, stay safely distant from those they love and care about. And again, stay healthy. Have a great day.